Good morning, everyone.
Good morning.
Can you see me?
Yes, we could.
Okay. Good morning, everyone. My name is Ibukun Tunde-Oni. I'm the CEO and founder of Eighmedical. And a couple of years ago, I lost my uncle, two of my uncles actually, to needless deaths. One died due to an asthmatic attack while he was on his way to the hospital. And the second one passed while at home with his wife and family during Christmas. He died of a cardiac arrest. He died of a cardiac arrest, literally. I myself was involved in a road traffic accident, and I was able to get access for 2.5 hours. And I'm a medical doctor by training. So this is literally the situation of 1.6 million people who die needless deaths every year. And 1.52 billion African people, right, who currently lack access to urgent and emergency care. And this is either because they don't know what to do, who to call, or where to go in an emergency. So I decided to turn this pain, all this pain, into a product, which is why we have Eighmedical today. So Eighmedical basically, right, is a platform that connects emergency medical resources, people, ambulances, and hospitals to users in distress in 10 minutes or less. This is achieved either via call, scheduling, or API integration, right? So what we're basically trying to achieve is a cloud-native EMS platform that provides on-demand urgent and emergency care when and where it matters most, using a large and active responder network, organized communication and dispatch system, fast and agile emergency response, and an emergency care fund to help with the transition from pre-hospital care and eventually to the hospital care, which is where everyone ends up going, right? All of this at an affordable price. Currently, we serve 0.005% of the Nigerian market, and we're looking to tap into 10.6 billion of the Nigerian market and eventually the African market. And that's because, as we all know, COVID-related and even the recent floods, right? There's a growing demand for public safety systems and data to even back all this up. Our current revenue model, we have a transactional commission-based emergency as a service and a care now pay later model. And we're able to provide services for a B2B2C clients, the B2G, which is the government, and a direct-to-consumer model. In our past 16 months running, we've been able to grow our responder network to 375 plus. We've processed almost 13,000 calls now, saved 5,000 plus lives, and generated almost $500,000 in the process. And this is through our ambulance standbys, which we have for events, productions across the country, an actual emergency response, ground ambulance transports, which we do locally, interstate, intercountry, and air ambulance transports. In Nigeria, our competition is Emergency Response Africa. We have people in South Africa, Aura, Flare in Kenya, StamPlus in India, and United Heart Alliance in Israel. We're unique in Nigeria in the fact that we're motorcycle responder friendly. So we go out with motorcycles, which you saw at the beginning of the deck. We're motorcycle first responders, and we have an emergency care fund, which will also help to support our responders. In terms of the Sustainable Development Goals, we provide climate resilience solutions. We help with gender equality, most importantly, good health and well-being. Our team is made up of, our leadership team is made up of Janine, myself, and Dr. Kelechi, with a combined experience of 40 plus years. We have an advisory board who's also medical, startup and economic oriented, and across board, they have at least 60 years of experience. We're currently raising $1 million. We currently have $220,000 raised so far. We're hoping you can come on this journey with us. Feel free to reach out. Thank you very much.